Now we are going to talk about lower urinary tract symptoms. These are symptoms which arise from the urinary bladder and the urethra. The kidneys produce urine, they are stored in the bladder, and there is a sphincter or valve mechanism which prevents continuous leak of urine. And then the bladder muscles contract, the sphincter opens and urine comes out. So, if there is a group of symptoms called obstructive symptoms, these occur when there is a block or obstruction to the bladder outflow, which is the prostate gland is a common cause for this obstruction, and this is located just above the sphincter. So, when there is obstruction, initially the bladder has to generate higher pressure to start passing urine. So, this is called hesitancy. People notice that they are not able to pass urine immediately as soon as they reach the toilet. Then the next stage is that the urinary stream becomes poor. You are not able to pass as forcefully as you used to do with the increase in pressure. But then the bladder muscles are strong enough to completely empty the bladder and pass urine at one go. Then with further obstruction, it reaches a stage where the bladder muscles are not able to continuously contract and empty the bladder. So, after some time the force varies, it goes up and down, and the flow rate also is sort of goes up and down with the contraction of the bladder. This is called intermittency. When the bladder muscles are hypertrophied and they are not able to produce sustained contraction. Then it finally reaches a stage where there is incomplete voiding. This is because the bladder muscles or detrusor muscles are not able to generate sufficient pressure to completely empty the bladder. Up to 30 ml of post void residue is acceptable. Beyond that, it causes problems because it reduces the functional capacity of the bladder and also causes the irritative voiding symptoms. So, the first group of obstructive symptoms are hesitancy, poor stream, intermittency and incomplete voiding. Then we have this irritative symptoms. So, this happens when there is inflammation or infection of the urinary tract, which causes a burning pain which occurs during micturition. Then also there is increased frequency. Even with the simple obstruction, the frequency increases if the functional capacity is reduced. This is more noticeable at night, starting as nocturia, then increased daytime frequency, and then finally it lands up as urgency when the muscles are irritable. So, once you have the desire to pass urine, it is difficult to hold. You will have to rush to the toilet to pass urine. So, these are the irritative voiding symptoms. But of course, there are other symptoms. If there is a stricture or the urethral passage becomes very thin, the urethral stream becomes narrow, and you will have to exert a lot of pressure to forcibly get the urine out. Then you can have incontinence of urine when the valve or the sphincter is not working properly. And then there is a continuous leak of urine if there is a fistula. So, these are some of the other symptoms. Another symptom is the blood in the urine. It can be microscopic or macroscopic, where the patients can see. Even microscopic hematuria is very significant. So, how do you evaluate this? We do what is called the urodynamic test or the cystometrogram, or commonly called bladder pressure study, is to find out what exactly is happening. Stop. Then we will go to the next three, cystometrogram.